Welcome to the next segment of our learning series on team-based care basics. This program is brought to you by our regional chronic disease collaborative partners in Alaska, Hawaii, Montana, and Wyoming. In this segment, we will review what to consider when establishing our care team members and defining their roles and responsibilities. Let us review the actions from the previous segment. In the last segment, we built on the goals and measures we set, information gained from assessing our practice and staff, and the future state we began to define. In this segment, we will determine the composition of our team and begin to assign roles and responsibilities for them. We will also begin to identify the training and support needs for our team-based care model. When creating our team composition and determining their roles, we will want to reorganize the work so that staff roles are expanded. Encourage and support all care professionals to function to the full extent of their licensure. Utilize protocols and workflows to increase independence and efficiency. And engage the best of each team member to create a patient-centered experience. Team-based care is a collaborative system in which team members share responsibilities to achieve high-quality and efficient patient care. Team members may include both healthcare professionals as well as non-clinical administrative and support staff. Teams may also include these other practice or partner team members to provide a wide range of care to meet the needs of our patients and practice. Don't forget the most important team member, and that is the patient. Their roles may include participating in shared decision-making and expressing their values and preferences, setting and endorsing treatment goals, practicing self-management and using tools to monitor and report their own health, and collaborating with the healthcare team as an improvement partner. We want the patient to encounter a united care team that looks and feels like a well-functioning unit, working collaboratively to meet their healthcare needs. When choosing our team composition, use the goals and the ideal future state created during our design process. Determine what is possible with our current staff, resources, tools, and support systems. We'll want to identify what changes we need to make to get to our future state. We may not be able to implement our ideal future state, so we should choose a place to start. Even the small changes we might make can move us in the direction of our ideal future state. We can use the primary care team guide for a deeper dive into how we might assess and expand roles for our team. In each learning module, there is an overview, action steps, and tools and resources that might help us as we establish our team and define their roles and responsibilities. Along with the staff assignments, other factors may come into play to make our team-based care model work, things like training needs or changes we may need to make to our EHR and other support structures. Some of these items may define or limit what we can do now, or whether we use a phased approach when implementing team-based care. Based on the goals we identified, we will begin to define our team by asking these questions. Who should be on our team? How should our teams be organized? Who should be responsible for what? What does each team member do? Remember, our vision for team-based care and the goals we want to accomplish will drive the composition of our team, and our goals may change as we learn and experience more. Now that we have an idea of the team composition, revisit the goals we established. Is this still possible with the team composition we identified? What elements may need to be changed, added, or removed? Revise the design as needed to produce a more solid draft of our team-based care model. Remember, this design is evolving as we learn more. This is to be expected. Plan to replan. Based on the preliminary composition of our team and our revised design, think through the services we will offer. For each of them, begin to define the shared goals for each specific service or workflow. Who will be responsible for what part and what they need for training? What system and process changes will need to happen? How will communication and documentation support this? How will decisions be made? And how will staff provide feedback? And what will we measure to ensure this change is having the effect we hope for? Answering these questions for all the changes in our design will help further refine the design of our team-based care model, our team composition, and begin the implementation planning process. Communication is key in delivering successful team-based care. It is necessary between the team, the patients, and through electronic documentation that can be shared with other partners and stakeholders. Keep these communication strategies and structures in mind as we develop our processes. There are things we can do to help prepare our team for our changes. Establish a clear vision for our changes, including the value to the organization, the employees, and the patients. Communicate openly and frequently about the change process, and what might be expected. Involve team members and stakeholders in the process. Address concerns that arise proactively. Provide a safe environment for honest feedback. And don't hold on to changes or concepts if the data or experiences provide unexpected results. Allow the design and plan to evolve as new information is presented. Change can often bring uncertainty. To prepare our staff, we can work to answer these questions. How will each team member or stakeholder be affected? Is the change going to be positive, negative, or neutral for them? Who will lose what because of the changes? We can help people through the transition if we consider how to acknowledge what they might be losing. Who are the key individuals that might help advance or hinder changes? We will want to anticipate possible resistance and plan for it. There are usually key individuals who might help progress or hinder our change efforts. People with influence may not even be involved, but they have influence over others. Make sure the people with the largest impact are on board and can provide positive influence. People with experience may have done this before. Identify ways they might make the changes successful. Some people may be vocal, they may or may not have a lot of influence. However, they may affect how this change happens. People who support the change can be used to help positively influence others. Work proactively to address the needs of key individuals and what support each one might need or offer. Typically, resistance originates from fear. Fear of losing proficiency, fear of losing employment, or fear of not being good in our new role. Resistance to change is natural. The key is to address resistance with open communication and actively listen to those affected. One way we can proactively plan is to identify how our team and stakeholders will be impacted by the changes, their anticipated reactions to the changes, and to have an action plan in place to address issues as they arise. Our team-based care model may bring new group dynamics to our team. We might need to learn to work together differently and may go through different stages of team development. Teams will go through these stages, defined by psychologist Bruce Tuckman. Forming is when people get to know each other and their roles. Storming is when conflict and friction can arise as people's true characters start to emerge and they push against changes or boundaries. Norming is where people start to resolve their differences and appreciate each other's strengths. Performing is when our team is performing at its full potential. Remember, it will take time for our team to develop fully. The needs of our team should be managed as part of our team-based care implementation. These are our calls to action for this segment. Assess our current staff and define new roles and responsibilities. Create and implement a people readiness plan to help prepare our team for the changes that are coming. Continue to build out our design. Decide what to include and what our team will need for training and support. In our next segment, we will review what is needed to implement team-based care. Thank you for joining us.